Vasanth. I'll be refuting ITSA's argument on the Affordable Care Act. So the claim I'll be responding to is the Affordable Care Act will positively alter the cost of healthcare for the middle class, keyword being middle class. So her first secondary claim is that the Affordable Care Act will decrease costs through increased quality of healthcare. My response to this claim is that the Affordable Care Act will increase the cost of insurance while unnecessarily providing families with much unneeded coverage. ITSA provided us with facts like the medical system wastes an estimated $750 billion a year and that billions of dollars are spent on repeated tests and such. She then claimed that the CARE Act will provide a higher quality of care that will get rid of these losses. However, there are no qualifiers, definitions, or authoritative and statistical evidence that are provided to explain what quality care is and how it differs from the care being currently provided. This leaves us with questions such as how much money will be saved? Will the companies or the middle class profit from these perceived decreases in costs? How successfully will the Affordable Care Act save the $750+ billion from being wasted? I have the answers to these questions. Obamacare does not have a definitive plan for saving the money. Rather, it will increase spending by roughly up to $621 billion, according to the National Health Expenditure Projection. The health expenditure projections are from the government. This will happen in the first year alone. In association with the typical middle-class family that consists of four, it will increase spending by $7,450 for that family. In this case, neither the insurance companies nor the people will benefit from the extra unneeded health care. Her second claim was that the Affordable Care Act expands Medicaid, healthcare for the needy, which will benefit the middle class. My response to this claim is that Medicaid will not help the middle class, but rather the lower class. ITSA was correct with their numbers when she said that those adults at 138% above the 138% federal poverty line have the eligible household income of $31,000 will prosper from Medicaid. But what is missing is the distinction of middle class and the people that are going to be helped. A middle class family is distinctly considered to make $50,000, not $31,000, according to the economists from USA Today. The range is typically $40,000 to $60,000 across many universities and economists, placing $50,000 as the mean. Thus, the provided evidence is unrelated to the middle class and does not accurately back the secondary or the main claim. Respectively, it will be the people that will save the money, and it will be these people that will save the money and have an increase in range of healthcare and not the majority of the middle class, but rather the lower class and the lower middle class. Her third claim was that the Affordable Care Act will prevent insurance companies from wasting your healthcare money and prevent them from imposing unfair rules. The Affordable Care Act will be notorious for its small print spending rather than for its rebates and give-back programs. The advocate was also correct in saying that people will be given a rebate if there's too much expenses used on operations by insurance companies. But what isn't stated is the viability of this. Factcheck.org states that the idea that insurance companies could financially do that as overly optimistic, misleading, and to some extent contradicts one of Obama's own advisors. But in the unlikely case that insurance companies do go through with this, there will be small print side effects that will occur, according to Forbes.com. Those people that decided they don't want to comply with the Affordable Care Act will be expected to pay a penalty similar to a fee. The first year will be 1%, but every following year it will increase by 0.5% for the next 3 years. The same insurance companies are giving you rebates in the unlikely case that they end up spending too much money. You will be expected to give it back to the government if you do not fully comply with their regulations. ITSA's given statement was one-sided and didn't address a proper rebuttal to these given facts. An acknowledgement of the opposing side's argument should at least be made in order for the audience to get a full picture. The advocate's fourth and last claim was that tax credits and subsidies for those tax credits and subsidies will be given to those with middle income. My response to this claim is that regardless of tax credits and subsidies, the middle income family will still have to pay an increased amount in their basic insurance payment. ITSA stated that families within a range of $23,000 to $94,000 will be eligible to save money on their premiums. The source used in this evidence was that of the government healthcare is the government healthcare website, and it didn't state what income was considered to be middle class, like I did earlier in my speech, or the exact amount of money that they will save. Or for that matter, it didn't even provide a range or any number. However, the same source, the government healthcare website, states that insurance companies will have to pay at least 60% more once the Affordable Care Act comes into play. And even though middle-class families might save money on premiums, they will definitely have to pay far more in their basic coverage. Going back to the original claim, this was the only evidence backing it. Without more background information, no serious conclusions can be made. Overall, I believe that the argument made was substandard due to the evidence or the lack thereof. Only 2 of the claims seem to have reasonable but minimal evidence backing them. Thus, the Affordable Care Act will negatively alter the cost for the majority of the middle class.
All right, well, the biggest part of your argument that comes up in 2 or 3 supporting points is the definition of what the middle class is, and the advocates either overly optimistic definition suggesting the middle class is really the lower class, or that these benefits and the subsidies are not going to reach up as high into the income levels as is believed. I think you do a pretty good job explaining why that is an issue. You ask a lot of questions in the course of the argument, and I think that's not unreasonable, but the answers to the questions need to be the claims that you make, and there are only a couple of times when you're as specific about that as you could be. For instance, on the first point, I thought that you had a good piece of information that says that the costs are going to increase substantially. You give us a cost of $621 billion in increased government expenditures that's going to result. And for instance, for the middle class, this was interesting, that you're going to have a $7,400 increase in what they're paying each year. I mean, that goes specifically to the claim that the advocate was talking about. You also suggest that this evidence is more reliable because it comes from government sources. This is not an estimate by an outside group, but rather it involves government accounting procedures. That addresses that question. You need to be very forceful in making that particular claim. Now, the question about whether or not the money gets wasted, I think that's an interesting point, that you make the argument that says there's nothing that assures that the waste is going to disappear with the Affordable Care Act. And I think that you need to explain how the advocate is suggesting that the waste is supposed to disappear versus what the reality is. And the argument that waste can't disappear either because of administrative procedures, we're seeing examples of administrative issues going on now, or for instance, if you're expanding coverage and there are people who don't need coverage, it's probably just as wasteful to insure people for maternity care who are past the age of childbearing as it is to require tests of people, a second or third test to confirm something that, the hospital has already said this is safe or it's not safe, and they're requiring more tests, and that's where the waste is going on. So which one is more wasteful? Which one's more expensive? That's a good question to ask, and I think you ought to be able to say it's unlikely that waste will be saved simply by changing the coverage, which is what the whole premise of the argument is, that people will have coverage so it'll reduce costs in the long run because they'll get early care and that sort of thing. Are there any counterexamples? That would be a good thing to include there also. And again, then we get to the whole definition issue. I thought you did a good job on that. The tax credits issue, that's where there's some complication because we have to know how high the tax credits and subsidies are going to reach. And we don't really get very clear information on that, although it did seem like both the sources that you're citing at the end seem to suggest that it's unlikely that it's going to reduce costs or reduce waste, or that it's going to make it affordable. I mean, the insurance companies are going to be paying a substantially higher amount. You've already shown how most of the people in the middle class are going to be paying a substantially higher amount. The notion that the subsidies are going to compensate for that seems to be a little bit hard to believe, and I think you need to be a little bit more effective in saying that. But I thought that you tapped most of the major issues there. All right.